Okay, this video is going to be about anxiety. I've been having a lot of problems with anxiety lately, especially surrounding work, and I'm sure others experience this as well, whether you're bipolar or you just have anxiety problems. But it seems like bipolar and anxiety go hand in hand so often that it's something that should be talked about. Anxiety can just be so crippling and unpleasant to endure that it makes life really painful to live. I'm not suicidal at the moment, and I'm not really even depressed, but my anxiety is really killing me. I feel like it makes my life 10 times harder, especially at work. It makes it hard to do simple things like cook because I'm worried I'll have to talk to my roommates. Even though they're very nice people, I just get too anxious to face anyone. I guess that's social anxiety. I also end up avoiding people, avoiding the public, avoiding tasks at work that I really need to do just because I'm too anxious to talk to the person I need to talk to. I even get anxious about talking to my friends or the guy I'm dating, which is awkward. But it's not just anxiety about talking to people or being around people, it's also anxiety about the future and about bad things happening. I'm paralyzed by my fear about my own future and about how if I keep up doing how I'm doing, I'll be a failure and always be miserable and have a minimum wage job and end up killing myself or something like that. I always worry something bad will happen at work, too. I work at a nursing home, so I worry about people dying, which could actually happen, or I worry about dropping people and having them break hips or their backs and causing me to get fired, or I worry about not helping people at the nursing home fast enough and getting fired, or for mischarting things, or just everything that could possibly go wrong I worry about, and I convince myself that these things will happen. I know it's irrational, and I know the difference between healthy anxiety and unhealthy anxiety. Healthy anxiety pushes you to do things you need to do and avoid getting hurt. Unhealthy anxiety dominates your thinking and ends up getting in the way of letting you do the things you need to do. The thing that kills me right now is that my psychiatrist seems to think that all the antipsychotics he's throwing at me will knock out this anxiety, and so far that just hasn't been the case. I've tried Abilify and Latuda and Risperidone, and none of them have helped with my anxiety in the least. It seems like if he wants me to get through this high level of anxiety, he should prescribe something that's actually geared towards anxiety, like a Tenolol or Buspar, or something. I'm not a med expert, but there has to be something out there. I know there's something out there because he recently prescribed me Klonopin, and that works great, but I can't take it all the time because it'll lose its effectiveness, or I'll get hooked on it. I wish I could just work through the anxiety with talk therapy, which I do, uh, but I feel like I have to have the anxiety go down at least a notch before talk therapy will actually benefit me. And so I wanted to know what you all think. Are antipsychotics effective for treating anxiety in your experience? Or have you needed something extra? Or has talk therapy been enough? Or maybe you're just one of the lucky people who doesn't have to deal with anxiety. And if you are, then you're very lucky. That's all I have for this video. Thank you for watching.